We start tonight with the Trump administration, who is once again withholding funds from California. This time, nearly $1 billion in federal Medicaid funding is being withheld over what the Trump administration says is high risk of fraud, waste, and abuse. I want to bring in ABC 10's Jeannie Nguyen, who's here with us for what this means for the state and also how, of course, Governor Gavin Newsom is responding to this news.
Alex, California and Minnesota are the top two states impacted. The Trump administration says the states need to stop the fraud. Meanwhile, Governor Gavin Newsom says this is all political theater, risking those most vulnerable in the state.
If we suspect fraud, you will not receive taxpayer dollars until you prove that those payments are legitimate.
California is one of two states the Trump administration says is under review for possible Medicaid fraud. Health and Human Services Secretary Robert F. Kennedy Jr. says the federal government is deferring about $867.5 million in Medicaid payments to California until the state provides documentation showing the money was spent in compliance with federal requirements. Centers for Medicare and Medicaid Services Administrator Dr. Mehmet Oz says the review is focused on California's spending for its in-home supportive services program during the past 2 fiscal years.
California's spending in these in-home programs went up 24%. The rest of the country's average is about 12%.
Attorney General Rob Bonta, along with 14 other attorneys general, sent this letter to the Trump administration, arguing that withholding this money would negatively impact those most vulnerable and smaller hospitals. Bonta says Medi-Cal, the state's version of Medicaid, covers more than 1/3 of the state's residents. Democratic Congressman Bera is concerned about the impacts to hospitals statewide.
It's going to affect all of our hospitals because when people lose their coverage, it doesn't mean they're going to stop having heart attacks or other healthcare conditions. They'll just go to the emergency room, which means it's going to impact our entire community because emergency rooms will get backed up. Community clinics won't be able to see those patients because they won't be able to get reimbursed for that care.
During a press conference on Tuesday, Governor Gavin Newsom accused the Trump administration of political theater, adding that the state had been actively working with the federal government to produce the documentation that they were requesting.
We've been working with them in good faith. They have issues with IHSS, and our issue is, why not IHSS? We believe in keeping people at home, dignity in place is a way of not only helping community and families and seniors and those with disabilities, but also to save the taxpayers money. We have one of the lowest rates of growth in skilled nursing facilities.
A spokesperson with the California Department of Healthcare Services tells us it's calling on CMS to stop threatening care for the state's most vulnerable residents, adding that California's approach to the in-home care system has been long approved by the federal government and saves state and federal taxpayers about $100,000 per person annually versus care at a nursing facility, Alex.